This is the Cancer Interviews podcast. I'm your host, Bruce Morton. It is tough enough for a parent to learn his or her child has cancer. It is tougher when the parent becomes the child's caregiver. That was the experience of our guest on this episode. Bhavika Taunk of Danville, California, became a caregiver when her son was diagnosed with leukemia. She came to his aid, and now she wants to come to the aid of parents everywhere whose kids have cancer. Now's the time to hear her story. And Bhavika, welcome to Cancer Interviews.
Thank you, Bruce. How are you?
Just great, and looking forward to hearing your story. First thing we want to do is learn a little bit more about you, your life outside of cancer. So if you would, Bhavika, tell us a bit about where you're from, what you've done for work, and what you like to do for fun.
Sure. It's nice to meet everyone here today. Thank you for having me on. There's not a lot of free time, as you can imagine, being a full-time caregiver of not just Kabir, but I have a younger son as well, Ayan, and he's 11. Kabir's journey started, about 9 years ago in 2017. So with that being said, as I mentioned, there's not a lot of free time, but I used to love to travel. There hasn't been as much of that. I love reading. Audiobooks has been a lifesaver for me these last 9 years. I love reading. I belong to a few book clubs. We love tea, like the drink. We have a small tea business. And I'm out of Danville, California, just north of San Ramon. Both of my boys were born in San Ramon, so this area is really home for us. We've had to move around a lot for Kabir's treatment, but we've come back to this area. And prior to this, I used to work in sourcing or purchasing, buying overseas products or even domestically. But I haven't done that for a while now.
Now, regarding your son Kabir's cancer journey, when did you first notice that something with his health wasn't quite right?
So it was 2017, April of 2017. Kabir was 4 years old. We had just come back from a vacation with some family, and it was a Disney cruise. With that being said, it's relevant because, when I noticed Kabir was not doing well, and I'll explain the symptoms, I started to think like he may have been exposed to something like a rare bacteria or something on the cruise ship because, first I initially thought virus, but then when things weren't really progressing or getting better the way I expected, you never, ever, ever think cancer. Never in a million years, especially with a 4-year-old. You're just never prepared to think that. Kabir came back off the cruise. His brother and him, were 4 and 2 years old. So they returned to preschool. And whenever you reintroduce these kids or they're all coming back from spring break, everyone's been traveling, it's pretty typical that they'll pick up like a virus or get sick. Now, my younger one did get sick, but he got better. Kabir did not get better. So that was obviously the difference. But with that being said, the symptoms of pediatric cancer, especially what Kabir had, leukemia, specifically Philadelphia chromosome positive acute lymphoblastic leukemia, or PH plus ALL. You hear that a lot in the pediatric cancer community. But going back to what you asked, Kabir complained of wrist pain initially, really, really bad, like his wrist hurt. We had it x-rayed. No, nothing was found. There was no swelling, nothing obvious. I just remember this weird exchange because it wasn't our regular pediatrician and it wasn't me that time. The first week, it was my husband. They were kind of like, how come you don't know why Kabir's wrist is hurting this bad? And the school people were asking us and we were asking the school, like, did he take a fall? Did something happen? Nobody knew, but it didn't get better. They put a brace on it. Within the next week, he started having intermittent fevers. Like, I would notice he's burning up at night and would be gone, and I would think it's going to pass, but then a few days later, the fever would come back. So things weren't really following a normal trajectory. And then his ankles, that was like the symptom that was by far the worst. His ankle started hurting, both legs. Maybe one was a little worse than the other, to the point where he couldn't walk. I was dosing him Tylenol and Motrin, like around the clock at this point. With his pediatrician's guidance, she saw him 2 days before he was diagnosed. So we had been back to the doctor a bunch of times since that initial x-ray of the wrist. We just kept going back, and I kept taking him back, saying like he's not getting better. Kabir had pediatric asthma, pretty stubborn asthma prior to cancer. So I had a good handle on like what was normal for him, what was not. And there was a lot of things that weren't making sense. For example, he was really, really breathless, but his pulse ox monitor and his oxygen levels were good, which is not normally what would have happened with him. And the last thing I can tell you, and I want to say this to parents, is trust your instinct. Because the night before Kabir was diagnosed, and again, by no means did I think it was cancer, but did I have like a sinking feeling in the pit of my stomach that something is very wrong with my child at this point? Yes, that he's not getting the attention that his case is requiring, as in maybe it's time he starts antibiotics. Maybe it's time we start looking at where he traveled. Something felt very wrong. He spent a lot of days with me at home those days, and I noticed he was pale in color. Again, very like subtle changes, but to me, they seemed like to be adding up. I noticed some dark circles under his eyes. I noticed he hadn't been eating well. And then he started complaining about stomach aches. So it all started adding up. And I trusted my instinct. And that night, my husband found me crying. I've told this story many times, around 5 or 6 in the morning by the side of Kabir's bed. And he woke up and he said, "What is wrong? What's wrong? Why are you so worried?" And I'm like, because this can't be pediatric asthma. If this is life with pediatric asthma, there's something wrong. Because we had been to specialists. He was on very controlled medicines. And I said, I know something's wrong with him. And he's like, "Well, I trust you. So if you really think something's wrong," I said, "Take my little one to daycare this morning. I am going to take Kabir to the pediatrician. If she's not available, I'm probably going to the ER with him." Luckily, she was available. She knew how his case has been progressing. We had a good working relationship. As soon as she put her eyes on him that morning, she said, "He didn't look like this 2 days ago." Of course, I did not feel relief because now my worries were like real, but they were validated. I felt like less crazy, I guess, like, oh, I'm worrying for nothing. And she agreed that we should go to the ER. And those were the symptoms. And, you might ask me later in the interview the rest of the story, or if you'd like me to tell it now, either way, of how his diagnosis came upon.
And how did it come about?
So she saw him that day. She warned me nothing about cancer. She said there are viruses that are really stubborn. They settle into the bone marrow, and that is why he's probably having a lot of pain in his ankles. So that made sense to me. I had a lot of cancer exposure in my family. There is, a lot of cancer history in our family. So, but not pediatric. Kabir is the first child I knew personally, not a friend's child, nobody. Like outside the St. Jude's commercials, I didn't know any children that had cancer as young as Kabir. So with that being said, we went to the emergency room. She ordered some basic blood work. She may have been ruling out things that she didn't mention to me. Within 30 minutes of being there, somebody said, "Your son's anemic." And I said, "Oh, he's absolutely not. Not that I'm aware." They asked me, like, "Are you aware your son's anemic?" And I said, "No," because my other son has a little bit of mild anemia I was aware of. And I said, "Kabir's never been anemic. He's never had, outside the asthma, anything on his blood work." So this doctor comes in, and that was my first real, Of course, I'd met with medical professionals before, but I'm talking like when things are in crises mode and when you are exposed to these types of, when the words really matter and they carry weight. But that's when you hear about bedside manners, because they're moving at a fast rate. And a doctor came in and said, well, it's 50-50. As confused as you may be is exactly how I felt at the time. I had no idea what he was referring to. And I'm like, 50-50 what? Like, I'm not sure what you're referring to. We know he's anemic. And he said, well, your son has a virus that has affected his bone marrow, and I'm waiting for the shoe to drop. And he said, or it's cancer. And just like that, I mean, within 30 minutes of being in the ER, like a semi-local ER up in John Muir, Walnut Creek, where Kabir was born, and so was his brother. And so I was just floored. Like, how is this on the list of, possibilities at this point, the differentials, as they call them. And then within like him saying that, a nurse walked in, maybe within 2-3 minutes of him saying those lines to me, and said the odds are not in their favor. It could have been, everything becomes a blur. Like you see in the movies, sounds start getting blurry, everything's moving slow and fast, and you're very confused. So she may have been standing there when she heard him say it to me, because she said the odds are not in their favor. We found blasts in his blood, which is like immature blood cells that should not be in the peripheral blood ever. And so I think at that point they were pretty convinced Kabir has leukemia. I'm the one that said it. Nobody said it to me. I'm like, so cancer in his blood. So are we saying leukemia? Like, I didn't know. Did he have lymphoma? I had no idea. Nobody had said anything to me. Not until maybe 5 hours passed that day did anyone say, when I asked the question, is he going to live? Is this treatable? I knew nothing about stats, nothing about curable, but I just asked, is he going to die? Like, we hadn't even discussed anything, but nor did anyone feel the need to make me feel better and say like, hey, this is treatable. We have protocols, and it might have been too much information anyways, but maybe they wait for the parents to ask. Well, upon hearing that, I remember being introduced to child life for the first time. Any pediatric cancer parent or any parent of a child that spends a lot of time in the hospital knows of that profession. They're wonderful. I asked someone that was child life to come sit with Kabir. I said, I have to go call my husband. I went outside. I said I needed to go to the restroom. I fell to the floor. I started bawling my eyes out, almost just like howling and crying. And someone came by and asked if I needed help. And I said, I don't even know what to ask you for. Someone just told me my 4-year-old has cancer. And I need to call my husband. And they said, would you like us to call him? And I said, no, I really need to make this call myself. So, I mean, obviously he had known we were going to the ER and he was aware his son was sick. So, but I remember just saying it, Kabir has cancer. And there was no way for me to soften that blow. And I remember him screaming. He was in the city. He was in San Francisco. I remember him like screaming out, no, like this can't be real. And I said, just go pick up our other son, like take Uber, whatever you need to do, and get to the hospital immediately. That took a few hours. He called a few more people, our parents, and one of my siblings who was an oncologist. With that being said, it was the day that forever changed our life. It always will be. There was a life before 4/2017 and a life after. And that normalcy for everyone might be different. For us, because as you will hear me talk about Kabir's journey, he went on to fight cancer 3 times, have a lot of types of treatments, and is still fighting for his life. There has been no return to normalcy. And I don't think there's a full return to normalcy for anyone, but the level at which your life resembles your previous life really depends on what you're going to go through.
Now, Bhavika, I have a grasp of what your answer is going to be to this question, but I want to hear it in your words. Given the enormity of a cancer diagnosis, especially for a child, to what degree did you feel a sense of helplessness?
Helplessness is the number one difficult feeling I feel since the day he was diagnosed until today. There's lots of feelings. There's depression and grief and anger and, in a weird way, gratitude, because you're living this dichotomy of life all the time. And with all the pain, you see the beauty, and you're grateful for every single morning, which that sounds extreme, but it lives in you, that he wakes up again and you have another day with him after you've seen him battle what you have. But helplessness is the core feeling that guts me as his parent. I can do XYZ, and I do those things to help alleviate some of my helplessness and some of his difficulties, but I cannot fix this for him. And so that creates a big, sense of helplessness. And as a parent, it is a core desire, intuition to protect your children for most parents, I would say. And you cannot protect him. I mean, the cancer's in his body. The cancer showed up. You can't make it go away without giving him extremely difficult treatments. He went through 2 years of chemotherapy. He failed. And he lived on something that is important to mention called a TKI. I want to say it correctly, but it's some sort of inhibitor. It's a TKI. It is dasatinib specifically, that is targets the Philadelphia chromosome. So he lived on the TKI plus 2 years of chemo, the entire 2 years. He failed. He went to relapse with an essential nervous system and his marrow tiny bit. And then we took him to Philly for immunotherapy or CAR T. And then he unfortunately failed that as well, relapsed again in his testes and some in his bone marrow again. And then he went on to have a bone marrow transplant, a haploidentical BMT, which means a half match. Whether it's 7 out of 10, 6 out of 10, if it's not a full 11 out of 11 or 12 out of 12 or 10 out of 10, depending on who you ask, it's called a half match. So he has been through so much treatment, and you are helpless. You are helpless with what he has to face. You're helpless of the complications that will arise, and you are completely helpless and not in control of what his trajectory will look like.
By the way, we hope you will find time to like and subscribe to our channel. And if you click on the bell icon, you'll be notified the next time we post an interview. And we want to remind you on Cancer Interviews, we are not distributors of medical advice. If you seek medical advice, please consult a licensed healthcare professional. Now, getting back to what looked like just a daunting lineup of things that Kabir faced in terms of treatment, Bhavika, what has been the toughest part?
His emotional, physical pain is very tough, but emotionally, or the toughest part for me is this loss of innocence, loss of childhood. You could say he had a childhood, but I don't think he had a childhood. I know there's this need for everybody to kind of, and I try to be positive, but I try to be realistic. I don't believe in toxic positivity, as it's called, where you just keep telling the patient, stay positive, think positive. It's not going to fix it for them. It might help, but validation, mental health, tackling the mental health challenges, just telling them to think positive and stay positive, or, so for me, his loss of childhood is the toughest. He did not go to school for years. He did not have friends. He still struggles to relate to his peers outside the cancer community. And sometimes within the cancer community, each of their journeys look different. Many of his friends pass away. It is a very, very tall order for a 13-year-old child who's been dealing with this since he was 4. So for me, the toughest thing is his entire childhood was lost, maybe up until 0 to 4 from what he remembers was semi-normal. But after that, I mean, he's lived in hospital beds for years. It's hard for people to fathom, but the initial round of pediatric cancer, leukemia, when you're talking about leukemia, at that time was 2 to 2.5 years. So not like 2 to 2.5 months, you know, we're talking years. And I just remember that being a sticking point where I just was like, wait, are you saying he's going to be like 6.5 when he just finishes to see if it works? Of course, you don't talk about that part initially. Everyone just assumes it's going to work, but you are given stats and quotes that you know this is not a guarantee. But the fact that the treatment is so long, I mean, years are lost. Years are lost. And so for me, that's the hardest part, that he did not get to experience a childhood. There was restrictions, immune system restrictions. We did our best. I think if you ask him on a good day, he would say, you know, yeah, I had my brother, I had a best friend, I video gamed. And that is true. He had some semblance of a childhood. But for my husband and I, the hardest part is he did not have a childhood. He was drowning in worries and stressors that should not be there for a 4-year-old child. So, I mean, obviously we can't stop that. We can't stop cancer from coming. I wish we could, but I definitely think we have strides to make the burden less in terms of shorter treatments, more effective treatments, and less toxic treatments. So there's definitely things we can do to help these children.
Bhavika, as we record, Kabir is just entering his teens. What is your vision of care for him as he goes through his teens?
So honestly, Bruce, you know, Kabir's trajectory has not been typical. And like I said, it's a range. Some kids battle for 2 years and they're in remission. And even they will go on to have lifelong complications from the treatments they received, because these are, the easiest way I can explain it is these are small bodies, growing bodies, rapidly growing bodies. And essentially what chemo does, because it has to stop rapidly growing cells, is it stops growth. So that is a very not an ideal paradox, because you're stopping growth in growing bodies. Whereas like if my heart received it, it might feel different. There might be toxicity, but like, you know, we're affecting the growth of these bodies at a not ideal time. So even children that, let's say, go through 1, 2, 3 years of treatment and they are in remission forever, their cancer never returns, they're going to live with lifelong complications. But Kabir, unfortunately, battled 3 battles back to back, a huge amount of toxicity. And if that had been the end, and he's 5 years in remission now from his cancer, I would say it would be like a lot of watching and a lot of monitoring and like annual follow-ups. But unfortunately, we're not there with Kabir. So the reality of what Kabir's life looks like is, after his transplant, he went on to develop some serious complications. The latest and largest problem we're facing is his immune system is dysregulated. And I don't mean like autoimmune, but it's more like his B and T cells don't work correctly. So it's pretty serious. It is somewhat life-threatening. It is life-threatening. If his attacks and flares don't calm down and we don't find the perfect medicine that won't make him so immunocompromised and prone to infections that could take his life. It's a very fine balance right now, and we need 2026 to show him nothing short of a miracle at this point. Our bone marrow transplant team told us in September of this year some very difficult news. I'm speaking about 2025, that if the immune system doesn't reset and start functioning correctly within the first 5 years, they don't think it will. So Kabir is not in a good place. So there's really no typical for us. What his teenage years should look like if the cancer was in remission is not what's happening with him. So we're on very active treatments. He is taking a drug called Cellcept. It's an immunocompromising drug to calm his inflammation and immune system down. He gets IVIG every 3 weeks. He gets a daily dose of steroids, and he takes about 40 other daily oral medications in the month, actually. I mean, most of them, like 35 plus, are daily, but there's a few shots here and there. So it's very intense. I can't predict what a year will look like. And as hard as it is for me to say, the reality is I hope he's alive and with us next Christmas, because something has to fix this year for that to happen.
Bhavika, we're going to wrap up now, but I do want to reference something that was mentioned at the very top here, and that is how you want to take what you've learned. Quite obviously, you know a lot more about cancer now than when Kabir was initially diagnosed, but knowing what you know, what are some of the things that you would like to do to help other parents whose kids have cancer?
The biggest thing these parents might feel is alone. There's a lot of loneliness in walking the cancer journey. So there's like 2 goals I'd say I have. For the parents, support. I have an online Instagram account, B Taunk, my initials. I do medical advocacy, disability advocacy, a lot of education around pediatric cancer. The bigger goal for all of us pediatric cancer patients, and I'm sure just like the rest of the cancer community, is like advancements in pediatric cancer medication. So a lot of people don't know that pediatric cancer, which I mean kids get all the types of cancers adults get, plus some, and it's a small population. So they get 4% of the NIH's budget annually. Now, some people argue that's 6 and 8, but as far as I've been in it for the last 9 years, it's 4%. That number has to change, because it might be a small population in the way they give out the money. Obviously, it's, there's a lot of things involved, political things, lots of things, but I know it's based on earning potential, and kids don't earn, so they get a very small amount back. And because it's a small population, in general, pediatrics suffers because it's a small population. Companies don't want to develop new drugs. The majority of drugs Kabir received, and I think, Bruce, I shared a list of chemotherapies with you, are from the 50s and 60s. We are giving these tiny bodies, and I mean babies, right? I've seen babies with cancer, hundreds and hundreds of them. We are giving them some of the oldest, most toxic chemotherapies because we're not developing new drugs for them. I think there's 4 developed in the 4 to 6 developed in the last 60 years, which is just, unacceptable. So what I'd like, and I have done advocacy work with blood cancers, they changed their name from LLS to, I think, Blood Cancers United. I've done advocacy work with them. I haven't seen that needle moved. I would like to see that needle move from 4 to 8%. It's mostly being funded by families that lose children. They open organizations. There's a lot of private funding that is done. But the parents need support. There's not a lot of, support groups happening at these hospitals. They feel alone. Their lives are turned upside down. They often have younger children, older children, other children that they can't be with for years and years and years as their other kids are battling for their lives. There is not enough resources. It is understaffed, undersupported, and it makes it very difficult to survive. And due to a lack of that, you see it. You see difficult, high amounts of divorce rates. You see mental health disorders within the parents, a lot of PTSD diagnosed, and the numbers are pretty high. Siblings struggle with a lot of, they call them shadow survivors. They live through a lot of the trauma from their siblings. And so I think like a lot of support is needed. And really where it's going to get better is if we better the treatments, because if our kids got better, easier, faster, less toxicities, their hearts aren't failing at 18, their lungs are developed correctly, it's going to be much better for the family in the long term. What we really, really need is for these kids to get better treatments. And all I can do is, if there's anything I can ever do for another pediatric cancer parent, because when I walked into this world, I just found a few parents online on Facebook, honestly, initially. There's no roadmap that's handed to you. Like, everybody's in the hospital together. You meet some people, but everybody's very inundated as well. So if there's anything I can ever do, if parents reach out and say, hey, do you know resources for financial grants? Do you know? I get lots of questions. I think the biggest advice I'd give them is be your own advocate. Nobody's going to hand you anything on a platter. Like, we thought when Kabir relapsed, we'd be like, here, this is what you should do next. We went online. We found our own clinical trials. We had to ask our doctors to apply for them. It's not as, there's not as much hand-holding as someone might think. So be your own advocate, reach out to other parents, ask them, with your own perspective of what advice you want to seek and what advice doesn't seem right to you. Like I said in the beginning of the podcast, you have to trust your own gut and intuition. Both of the times Kabir relapsed, I knew he relapsed before the physicians knew he relapsed. So you have to trust your own intuition. You're going to know when your child has sepsis. You have to take them in. You're going to know when there's other complications happening. So continue to use your own voice, advocate, and reach out to other parents so you don't feel as alone. That's all I can really say.
All right, wonderful. Bhavika Taunk, Danville, California, thank you very much for sharing some very valuable information for parents everywhere who are in the same club you are, maybe not with the same dynamics all the way down the line, but they're facing many of the same obstacles that you have faced for years now. So, Bhavika, thanks very much for being with us on Cancer Interviews.
Thank you, Bruce. Thank you for having me.
And we want to remind you as we conclude that if you are on a cancer journey, you or a loved one, you are not alone. There are people out there like Bhavika that have information that can ease the cancer journey for you or a loved one or a child who is also a loved one. So until next time, we'll see you on down the road.